Awesome. What an amazing reminder. Thank you, Leah and the team. Hey guys, I too just want to add my welcome to Leah and to Williams this morning. We make history today, Papster. So you are helping us make history today, and we are not going to let technology stop us. It may have delayed us, but we're not going to let it stop us. So in this part of our program, I really want to introduce you to this man here. We've got a really pretty big deal guest with us this morning, and he's going to hate that I'm saying that. He's one of those guys that, you know, has so many titles. He is that educated. So we have Professor Warwick Bagg. Warwick, what do you do? What is your day job?
Tēnā koe, Pastor Karen. I have a number of day jobs, but I work as a professor of medicine at the University of Auckland. I'm a specialist doctor, so I see patients particularly with diabetes and hormone diseases, and I work in helping to educate medical students to become our future doctors.
Amazing. You know, Warwick has really been an incredible resource to us at Papster in helping us navigate this whole COVID-19 thing. So I guess as part of that, Warwick, talk to us about what is COVID-19 or a coronavirus?
Yeah, Karen, so there's a lot of information coming out all of the time, isn't there? And it's hard to get your head around it. But coronaviruses are a large group of viruses that cause a wide range of disease, from the common cold to more serious forms of disease. And the one that we've got now is a new, or a novel is the word that's often used, coronavirus. Okay. And this one particularly targets the lungs, which is why people are getting very sick with bad pneumonia. So it's not that the group of viruses is new, but the particular one that has we're seeing at the moment, that's the one that's causing the problem.
Okay. And so what sets COVID-19 apart from some of the other viruses that we've had or experienced in the last few years?
So this one originated in animals, as most of the coronaviruses do. It's somehow jumped into the humans, and we have no human immunity to it. So the human body works on a memory basis, so you've seen something before and you can attack it when you've seen it before. Yep. In the whole of humanity, there has not been exposure to this particular coronavirus.
Wow, okay. And why the two names? Because, you know, we're hearing coronavirus and we're hearing COVID-19.
So the coronavirus is the specific virus that causes the disease. COVID-19 is the disease, and it's made up of an acronym which I'll just pop up here. You can see my academic credentials are not in art.
But see, it does make you a doctor because it's difficult to read.
Yeah, that's right.
Yeah,
so you can see there's CO for corona, VI for virus, and then disease. So that's how you get COVID and 19. So what's interesting to remember is this all just started in November, December, and here we are with a worldwide pandemic.
Yeah. Okay, so you just said pandemic. What is a pandemic?
Well, pandemic really just is a global outbreak of disease. So it's not just limited to one country or one region, but right across the world. And as you have seen on the maps, many people are, many countries of the world and territories of the world are now infected with this COVID-19 disease.
Wow. So talk to us about why you think it's important that we do church differently. I mean, I guess we had the opportunity to meet in 5 or 6 groups of, 90 people, or we are closing ministries that are smaller, that are less than 100 people. Why do you think it's important that we go to that extent?
Well, I think we need to treat this virus very seriously. We need to take on board that this virus has caused a number of deaths across the world and is spreading quickly. So the intent of the measures that the government has put in place is to limit gatherings where it's easy to spread COVID-19. And the 100 number is an arbitrary number. So what is the intent? The intent is to not attend non-essential social gatherings, and that's so that we can limit the spread. You know, it's a bit like the speed limit. It's a limit, it's not a target. And the road safety people talk about that a lot. So we need to drive to the conditions, to use another driving analogy. We need to, it's raining, it's wet, the road is slippery.
Yeah.
We need to slow down and recognize that it's not appropriate to keep doing things the same way we've always done things.
Yeah.
We need to start thinking about the fact that in many countries of the world, as we have here, and particularly in South Auckland, some very vulnerable people.
Yeah.
So how do we look after those vulnerable people? We do that by reducing the risk of transmission to those around us.
Yeah.
Every time we minimize non-essential contact, we reduce the risk of spread of this disease.
Yeah.
You know, there's no point in saying, oh, well, I can just go to another church because Papster's closed. Well, we're not closed, we're open, we're just delivering it to you via the internet.
Yeah.
And the purpose of this is because we believe in our role as being responsible human citizens, as people who believe that we're a God of love who would care that we care about others.
Yeah.
And the way we do that is by minimizing non-essential social contact.
Yeah.
You know, in the United States at present, they are recommending gatherings of no more than 10 people. That's how seriously they are taking it there now.
Wow. Yeah. And so at the moment, they're saying that there is no community outbreak in New Zealand. So do you feel like we've been premature in stopping or minimising our gatherings?
Absolutely not. I think what's hard to know is the lag time between people getting sick and then presenting with symptoms. So we don't know how long that's going to take. We're up to over 50 cases today, and there are a couple of cases that may or may not have travel histories. They're still working that through. So I think it's almost inevitable that community transmission will occur. If community transmission occurs, we need to estimate that maybe between 40 and 60% of the population is going to get sick.
Wow.
Now, the vast majority of those people, maybe 98%, are going to recover. But a large number of people are going to get sick, needing hospital care and intensive care units care. And we only have a limited facility for that. Now, the ministry is working really hard to up that capacity, to limit non-urgent surgery, to do lots of things that will help us to have the capacity. But what we're doing today and saying, look, let's limit the non-essential gathering, is we're trying to spread how quickly this virus will spread. It's about spreading the load. And again, I've got my primitive graphic, which I'll put up here.
Love it.
So on this side over here, we have a very big peak. If we peak like this, if this is the line here where people can cope, where the health system can cope, there's going to be a large proportion of people where we won't be able to cope. But instead, if we try and flatten this curve and have maybe a number of small curves, smaller peaks, then the health system will be able to cope. So a large part of what we're doing is let's start acting like we actually do have this virus rather than we're going to catch it.
Yes.
Let's think we actually have this now.
Yeah.
And how do we now limit something I already have so that we can spread the load, help our health system to cope?
Yeah.
It is very significant, this disease, and we've seen in countries like Italy that health services have been completely overwhelmed.
Yeah.
So we need to do our bit by limiting the spread.
How does it spread?
Yes, so it's very much like the flu. It can spread from person to person. If someone coughs or sneezes or talks, little droplets come out of their mouths. They can travel a short distance. They can settle on a surface. Someone else comes along and touches that surface, then touches their face, touches their nose, touches their eyes, and that's the way that it can be spread. And so that's why we need to think carefully about the ways in which we can limit spread.
And so what other ways can we limit the spread?
Okay, so again, it's about thinking about you actually have the virus now, not that it's coming, that we have it now. And so washing hands is really important, and it needs to be 20 seconds of hand washing with soap. So singing happy birthday twice is very long to sing when you're trying to wash your hands. Believe me, I've been trying to do it. But do it, okay? And you want to wash all of your hands, the tops, the bottoms, each finger, your wrists, and then you want to rinse them clean, and then you want to spend the same amount of time drying your hands, because wet hands really easily pick up viruses and transmit them. So washing your hands and doing that before you eat or handle food, after you've been to the bathroom, after you've coughed or sneezed or blowed your nose, or you've wiped your children's nose, go and wash your hands. And after you've touched public surfaces. Now, if you think about that, that's starting to be a reason why we're being more careful, why we're trying to isolate a bit more, because we've got to try and limit the spread. I'd encourage people not to touch their face. I'd encourage people, to use good etiquette. So we saw William earlier on showing us how to greet one another. Yep. So if you happen to cough and sneeze, cough into your elbow. Don't do it into your hand. If you're home, for heaven's sake, even if it's just mildly unwell, please stay home, okay? Yep. And stay home until you are well again, all right? Yep. Keep 2 meters away from people, and think about your phone as a bug incubator. Your phone, which you touch every time, and then you touch the floor, you touch something else, we're forever on our devices. Yeah. That is one of the surfaces on which this virus will live. Yeah, wow. So, and these measures are especially important in the groups of people where this virus is targeting the hardest. So that is in older people, that is in people with underlying conditions like asthma, lung disease, diabetes, heart disease. Yeah. So that's again another reason why we're saying let's act ahead of the curve. Yeah. If we have community transmission in New Zealand, it's only just starting. Let's try and get ahead of this. Yep. Let's try and spread the load.
And I love that. And I think it is so important that we are protecting the more vulnerable in our communities. So talk to us about the flu vaccine. Is that going to help at all?
Yeah, absolutely. So I would strongly encourage every person to have a flu vaccine, starting with those people at highest risk, so the over 65s, people with underlying medical conditions. Yep. The government has brought forward the flu vaccine. Yep. Please go and get your flu vaccine. It is funded for those people.
Awesome.
Okay. Yep. And it's not going to help you from getting COVID-19 disease, but it will help you from getting sick from the normal flu, which will lessen the demand for health services. Remember, our health services are limited. We don't have infinite health resources. So anything we can do to limit it. And what we also often forget is that hundreds of thousands of people die every year from the standard flu across the world.
Wow, yeah.
So we're doing ourselves a favour. So please go and get the flu vaccine as soon as you possibly can, but remembering the priority. Yeah. It's the older people and the people with underlying conditions who need to be vaccinated first.
Perfect. Okay. And talk to us about a vaccine for COVID-19. Is that underway? What's happening with that?
It's definitely underway, but we don't have it yet. The first human trials are underway, but it's going to take at least 12 to 18 months to have it approved. Wow. So we are way off a vaccine. Okay. And then there's the rollout of the vaccine. So while we are working on the vaccine, we are not there yet.
Yeah. Okay. And is there a cure then for COVID?
So most people who get this disease are going to recover. But they're going to recover with the need of help, which is going to be rest, making sure you've got adequate fluid on board, maybe some paracetamol. Some people are going to need hospital care, and another group of people are going to need intensive care support. There isn't a specific treatment yet, but there are many trials going on across the world with a wide array of drugs looking for something. Okay. But at the moment, there is nothing that's definitely shown to cure, and please be careful of the hoaxes that are out there and the nonsenses that are spoken about, okay? We need to look at the Ministry of Health website, a trusted source. If there is a cure, if there are drugs that will work, that's where we get the information from, not Facebook or other unreliable sources.
Yeah. So do you think that will help to make a difference if we do all these things?
Yeah, absolutely. You know, every one of us has got a role to play in this. The Director General, Ashley Bloomfield, has made it extremely clear that we all are in this together. It was talked about earlier about us getting through. We all need to get through this together. And we need to understand there's going to be peaks and troughs to this disease. At times, the restrictions are going to come right in. They're going to pull us in really tight. They're going to do what they did in Hubei province, perhaps, and stop us from moving altogether. Wow. And then they'll let it go out again. again,
Yep.
because there's a risk that we'll get a second wave of infections. So this is going to be a dynamic situation, and we all need to have some grace and some kindness for the government, which is working
Yep.
24/7
Yep.
to do the best they can in an unprecedented situation.
Yeah.
They have New Zealanders' interests at heart.
Yep.
This is nothing about anything other than caring for Kiwis
Yep.
and making sure we get through with the least possible harm,
Yeah.
and health is the top priority now.
Wow. Yeah, awesome. Thanks, Warwick. Do we need to be scared? Because there's a lot of fear out there.
And that's quite natural to have some fear.
Yeah.
And every person's going to evaluate their own risk differently. And that's important. So we need to be kind to others. We shouldn't be panicking, but we need to be smart, and we need to be thinking about the ways we can still connect. Because self-isolating is not social isolation.
Yeah.
We need to maintain our social connectivity, because that's what's going to help us stay well,
Yeah.
okay, mentally well.
Yeah.
All right? So we need to remain connected. So check on your family. Some simple things to do: don't go out and panic buy, but make sure you've got a few extra bits and pieces.
Yeah.
Certainly if you've got medication, try and get an extra month of medication, but
Yep.
just an extra month,
Yeah.
not to be greedy.
Yeah,
There's
yeah.
going to be plenty of supply lines.
Yeah.
The food industry's reassured us we'll all get all the food we need.
Yeah.
We just need to be sensible.
Yeah.
I would suggest that people only check the news once a day. Turn off your notifications. Turn off those Herald app notifications, because they are going to drive you demented. And of course, the clickbait, and
Yeah.
you know, it's not helpful to your
Yeah.
mental health.
Yeah.
Do the news once a day, and then put it aside.
Yeah.
We need to try and maintain our routines as much as possible, and we'll probably need to develop new routines, new ways of doing things. So keep your family doing, okay, in this new way of life, let's do this.
Yep.
You know, let's make sure we keep our routines going.
Yeah.
Don't look at your KiwiSaver account or any superannuation fund. It's going to go down,
Yep.
but it will go up again.
Yep.
All right?
Yeah.
And I think we need to keep hopeful this will pass.
Yeah.
The experience from China is that this was probably 4 months of
Okay.
real disruption.
Right. Okay.
China's starting to allow people out again
Right.
from the Hubei province.
Yep.
But we need to be prepared for that disruption and be patient.
Yeah.
But it will pass.
Yeah.
It will pass.
Yeah.
We've seen this 100 years ago with the Spanish flu. It was devastating, but it passed.
Yeah.
This will pass.
Okay. So, are we at the point where we all need to self-isolate, I guess, you know? How do we survive that well? I guess, you know, we've definitely got people that are a part of our Papster community who are in self-isolation at the moment. How do we remain, I guess, connected, like you just said, and mentally healthy? And who needs to isolate? Yeah.
So I think there's clear directions from the Ministry of Health as to who should isolate. So anyone who's arrived in the country, as advised by the Ministry of Health and the government, must obey the self-isolation rules.
Yep.
And that's a really important message. I think in terms of limiting contact and practicing some social distancing, that's wise if you're in those vulnerable groups. So particularly if you're an older person, if you have those underlying conditions, I think limiting non-essential activities is important at the moment. I think it's being prudent and wise.
Yeah.
But look for things to do that will help to build that mental resilience, which is important. So staying connected, as we talked about. Being in self-isolation doesn't mean you can't go and exercise. Get out and go for a walk.
Yeah.
You know, do the greetings that we saw earlier on. Just keep your 2-metre distance. It doesn't
Yeah.
mean being locked in a room. Be kind to other peoples. Go out and enjoy nature, and do things that are helpful to building community, but in a new way.
Yeah.
So think about, I saw an example the other day of a choir master who is now doing his choir via a video platform.
Oh, wow.
So 500 people are singing together in the choir via a video platform.
Wow.
Okay, so
Yeah.
we keep our spirits up, and we get through this.
Yeah.
We get through this.
Yeah, and we be creative, hey? So what would you say to people who say, isn't this all just a bit of an overreaction? We've not had a death in New Zealand. We don't have that many people unwell. What would you say to them?
I think it's we saw that what happened in Italy, that they went from 9 cases to many thousands of cases and deaths within a matter of weeks.
Wow.
We have to take this thing extremely seriously.
Yeah.
And it will be much easier in hindsight to say we were too careful than to wish we had have been more careful.
Yeah.
This is a very serious disease that even if it only kills 1 or 2%, that means out of every 100 people we know, 1 or 2 people are probably going to die.
Wow.
That's probably the number.
Yeah.
So if you think of our own Pepster community, people are going to die in our own community, and I'm not trying to be, fatalistic about this.
Yeah.
But that's, if we average out the numbers, that's what it looks like.
Yeah.
So we cannot take this thing less seriously. It's unprecedented for the government to shut the borders down.
Yeah.
It's unprecedented, the measures. The University of Auckland has effectively closed.
Wow.
And it's closed for a week, and I don't anticipate it's going to reopen. Everything's going to be digital. This is a serious, serious infection. And even though most people are going to get better, if 2% of a large number get sick and die, that's going to be a lot of people.
Yeah.
And we were already seeing how many people have died across the world.
Yeah, wow. And so if we do fit into that bracket of being over 65 or somebody with pre-existing health conditions, should we be self-isolating?
I think where possible, it's wise. I think, again, it's easy to be smart after the event. I think we need to try and be ahead of the curve. I think we need to be saying, what can I do to look after myself as well as my family and those around me? And if you do have those underlying conditions, I would suggest that as much as possible you limit your social contact in person, but not by phone your friends, use Facebook.
Yeah.
We've slated social media for a long time, but this is the time to use social media. Get on Facebook and talk to people. Don't read the rubbish, but talk to people. Share what you're doing.
Yeah.
Go out for walks. Even if you're in that vulnerable group, do not lock yourself away. Keep your exercise up. Eat well, rest well, drink water, keep yourself healthy. Yeah. And above all, just take care and be kind. And be kind to people who are in government at the moment who are making tough decisions day in and day out, doing the best they can under extraordinary circumstances. Let's keep them in our prayers, because this is a tough time.
Yeah. Amazing. Thank you, Warwick. I love that we've ended on those words, be kind. I think take care and be kind. What a great way for us to move forward in this.